Well, welcome to another one of our webinars we're doing for National Family Caregivers Month. My name is Erica Jacobson, and I am the Caregiver Support Program Manager here in Sioux Falls. And we are joined by Dr. Lighting here, and she's going to talk about caring for someone with PTSD. So I will turn it over to you, Dr. Lighting. It's all you.
All right, sounds good. So, like Erica mentioned, I'm Dr. Lighting. I am a clinical psychologist in our outpatient mental health clinic here at the Sioux Falls VA, and I'm gonna be talking today about caring for someone with PTSD. And before we jump in, just as a reminder, we're gonna record and post it, so we'll turn the recording off at the end for any specific questions, but making sure folks are mindful of that as we get going. So just have kind of a bit of an overview of what I'm going to kind of walk us through this afternoon during this talk that we've got is first kind of walk through an overview of PTSD. What is PTSD? What are the symptoms? What are treatments that are available? And then kind of talk through some effective communication skills for interacting with the folks in your life who've got PTSD. And then covering some things on how you can help your loved one who's got PTSD, and then some additional tools for caregivers specifically. All right, so let's start with our overview of PTSD, starting with what is PTSD. So PTSD is a mental health condition that some people develop after experiencing or witnessing a traumatic event, like combat, a natural disaster, a serious car accident, or a sexual assault. After someone's experienced a traumatic event, it's pretty normative to have symptoms in reaction to that. We know that a large percentage of folks experience a traumatic event. About half of Americans have had one happen in their life. It's very normative to have things like memories or feeling on edge or have difficulty sleeping after that type of an event. And it might be difficult at first to kind of do things that you think are normal, kind of those normal activities. We also know that most folks start to feel better after a few weeks or months. And so, in other words, for folks who do kind of recover from those experiences, eventually those symptoms like memories and emotions may trigger each other initially, but those kind of decrease over time to the point where they're not as connected to each other. If it's been longer than a month, then we're kind of looking at where it might be PTSD. We know that about 6% of folks will have PTSD at some point in their lives, and when we're looking at veterans specifically, that goes to about 10 to 20% of veterans. One of the reasons for that is we know it's more common to develop PTSD after certain types of trauma, like combat or sexual assault. Also, something to note is that for some folks, PTSD symptoms may start later on in life, or they are later on after a traumatic stressor, or they may kind of come and go over time. When we're looking specifically at our VA population with our veterans, we've got some common traumatic stressors that are military related would be things like combat, severe accidents, witnessing death or injury, military sexual trauma. And when we're looking at non-military related things that our veterans tend to commonly report, that would be things like childhood sexual abuse, sexual assault, witnessing threatened death or injury outside of military service. So when folks have experienced traumatic event and they do have PTSD, let's talk about what that can look like. So we've got kind of 4 clusters of symptoms that we're going to kind of walk through. And so the first one is going to be re-experiencing symptoms. That's things like nightmares, reactivity to kind of triggers, having memories that kind of pop in. Secondly, we've got our avoidance symptoms. That's going to be avoiding external reminders, or also internally thinking like avoiding thinking about it, avoiding memories about it. Third, we've got our changes in cognitions or moods. So those are our thinking and feeling, right? So that can include things like persistent negative emotions, a lack of positive emotions, self-blame, thoughts related to themselves or other people. And then fourthly, we've got our arousal and reactivity. So that's going to include things like startling really easily or kind of more than the people around them, difficulty sleeping, kind of anger outbursts. So we're going to walk through a little bit of each of these a little bit more. So when we think about re-experiencing symptoms, things that you might observe as the person in your life, in the life of someone who's got PTSD, is things like nightmares. It could be observing them having anxiety or panic symptoms in particular environments. So things like a public space or a crowded space, or having those kinds of reactions in response to certain triggers that might be connected to their traumatic experience. So certain smells or certain sounds. You might observe intense memories. Now, they might not report those to you, but they might appear lost in their thoughts or distressed without maybe a really obvious reason of something that had just happened. And you also might observe them acting as if the situation is happening again, where they're kind of not even aware of kind of where they are or what's going on. We call this dissociation or a flashback. With our second cluster of symptoms, right, those avoidance symptoms, things that you might observe would be that your loved one might stop doing activities that they used to enjoy, might not be doing hobbies that they used to do, might avoid doing certain things that remind them of the event. So they might avoid certain smells, certain sounds, certain environments, certain times of year, or at least certain things at certain times of the year. And they also might avoid having conversations about the traumatic events that they experience, things like changing the subject or avoiding people or places where the conversations might come up or people might ask questions. They might also use substances, so things like alcohol, other drugs, to avoid thinking or feeling, to kind of just kind of put everything on mute, or being really, really busy to avoid thinking or feeling, so they just don't have time to think or feel about anything related to the trauma. So again, that third cluster, right, we've got those changes in cognitions or mood. Those are going to be things related to thinking and feeling. So things that you might observe would be changes in the way that they see themselves or talk about themselves or talk about other people or the world. Might be kind of extreme or unrealistic blaming of themselves or other people. Might include appearing kind of stuck in negative emotions like guilt, shame, blame, or having seeming really difficult or unable to experience positive emotions like love or happiness. You might observe them kind of that no longer being interested in the things that they used to enjoy or not doing it in the same sort of way or as often. And you might observe them being kind of disconnected to the people around them, even feeling disconnected or distant from the people that they care about. And then that last cluster of symptoms, right, that arousal and reactivity. So things that you might observe within this cluster of symptoms within your loved one would be things like irritability and like anger outbursts. So that would include like verbal and physical aggression. You might observe reckless or self-destructive behavior, so driving really, really fast and not wearing their seatbelt. You might observe them being kind of extra watchful or kind of vigilant for danger that might happen in when they're outside of their home in kind of public spaces. It might also happen inside the home. Being easily startled or having a really intense startle reaction. So that might be a reaction to something like a door slamming or to kids kind of yelling or screaming when they're playing. You might observe kind of trouble concentrating or having difficulty kind of focusing on a task or on a conversation. And then also trouble with getting to sleep or staying asleep. So a lot of times this can be related to having difficulty getting the body to calm down enough so that it can really kind of rest and actually like relax enough to fall asleep. One of the things that I did want to spend a little bit of time kind of talking about is the impact of aging on PTSD symptoms and trauma-related symptoms. And one of the reasons I wanted to mention this is obviously we're all aging regardless of what age we are currently at. And a lot of times we don't always think about the changes that that can bring and the way that that can impact things like PTSD symptoms. So if you think about what changes come with aging, we know that some changes can make you feel more vulnerable. And some of these changes might make PTSD symptoms more obvious, more noticeable, might even cause flare-ups in those symptoms. Sometimes it's because strategies that helped them avoid their symptoms might no longer work. And so if they can't avoid the symptoms any longer, then they're going to be experiencing them in what kind of feels like an even bigger way than they usually do. It also might be because that the things that they used to cope with those symptoms, things like exercising or friendships with supportive peers, for example, might be more difficult to maintain as one ages. So some specifics, thinking through self-reflection. Like as folks age, you might want to look back over the course of your life. And in the process of doing that, some of those memories, those unwanted memories, or those traumatic experiences that you may had forgotten or maybe purposely kind of bottled up or boxed up, may end up coming back up more so. Retirement is a big one. When you think about retirement, one of the big things folks talk about is having more time on their hands. And then that can also happen for folks with PTSD is with more time on your hands, you have more time for memories and symptoms to flare up. I have folks coming pretty regularly talking about how they were fine, so to speak, until they retired. And then all of this stuff kind of came up for them. And that's because they were pretty effective at keeping themselves busy to avoid those symptoms until retirement gave them all this time. Loss is another one. So we think about the death of a spouse or the partner or a friend, family member, can mean losing an important source of support. And we know that social support is really big for folks coping with PTSD. And this can make you feel a little bit alone or unsafe, or it might make you feel vulnerable and kind of highlight your own health or your own potential for what comes next. And physical ability. Obviously, physical ability changes over the course of one's life. And we also know that those physical changes can occur more as folks age. So because things like a loss of physical strength or a loss of mobility or a loss of something that used to come easy and now comes with a bit more effort or a bit more work, folks might feel like they can't protect themselves or they can't respond in the way that they might have done in the past, which can cause kind of a flare up in some of those symptoms. Change in environment, right? So we think about folks who are coping with PTSD. A lot of times they're comfortable in their environment or they're comfortable within their routine. And some of that can bring like a sense of security. And so spending time in an unfamiliar place or a new place, so moving to a new home or staying in a hotel on vacation can really disrupt some of those routines or those environments, which might make you feel a little bit more on edge, a little bit more concerned, a little bit less safe, and that can kind of cause a flare up in those symptoms too. And then medical problems. So things like hospital stays, chronic illness, and end of life issues can absolutely impact the way that folks kind of think about themselves, their mortality, their physical abilities, wondering how they're going to react to certain things. So that can definitely cause flare-ups as well. We also know that there's research connecting and linking PTSD to hypertension and cardiovascular disease. So when you think about those hyperarousal symptoms that we were talking about, when folks are kind of really in those, a lot of times you've got increased heart rate, you've got increased blood pressure, you've got your body's reacting on that sympathetic nervous system, which can have that wear and tear effect on your cardiovascular system. So if you have PTSD, making sure that we're getting treatment for that, and at least getting it checked and monitored, can be an important part of managing your health as you age. So when we think about treatments for PTSD and what this can include, kind of covering multiple levels of treatment. So when you think about kind of the first level of treatment, kind of walking in and talking about maybe I should talk to someone or maybe I should look in to see what's out there. That's going to be our outpatient treatment. So within outpatient treatment for PTSD, this can include psychotherapy. So there are several treatments that are well supported by research to help folks target PTSD symptoms and the way that that's impacting their life now to work towards a different impact in the future. These psychotherapies there are ones that are done individually, there are some that are done over groups, and so those are definitely options for folks when it comes to treatments for outpatient treatments for PTSD. Additionally, we've got medication management of symptoms. And so this could be medication that is sometimes could be managed through someone's primary care provider and or potentially a psychiatry provider as well. When we think about kind of, that's the first level of treatment for PTSD, and we think about kind of maybe moving up a level where it's maybe a bit more intensive, that's going to be our residential treatment. When we think about residential treatment for PTSD, these are going to be treatments that are considered in situations where folks have kind of tried outpatient and it hasn't been successful for potentially a lot of different reasons. Maybe it's related to needing to have kind of a concentrated time to work on it. Maybe there are some increased symptoms where like I actually really just need an elevated level of help, or I need to be able to kind of do this in a way where I can take time off work. And I really kind of need to kind of do all of these things along with managing my mental health. And so when we think about residential treatments, a lot of times these are going to be roughly in the camp of kind of 6 to 8 weeks, where folks are going to go somewhere, stay, and do treatment of PTSD along with some other treatments as well, kind of getting this intensive, right, approach towards treatment. VA residential programs are in every VISN. So when we think about our VISN, where we're located, we've got residential treatments that are located in St. Cloud, and Hot Springs, and Omaha, and Des Moines. And we also have the ability to kind of refer to other VISNs or residential treatment programs if there's like a specialty program that's really seems appropriate for a particular patient. And then we kind of move up maybe into the next level, right? When I think about levels of care and kind of going even higher, that's when we're kind of talking about acute psychiatric or inpatient treatment. And this is a lot of times used in cases of kind of acute crisis where there are concerns for about imminent safety concerns, where we're concerned about imminent concern about self-harm or harm to another person. So thinking about those 3 levels of care, how do we go about even accessing some of those care? So if we're talking about that first level of care, that outpatient treatment, when we think about VA therapy, these are same-day screenings are available for VA therapy. So a veteran can kind of come in to primary care and ask to speak to someone about mental health, and they can get seen and kind of screened that day and get that process started for them. Another good starting point is to ask the veteran's primary care provider for a referral. If they want to kind of schedule something, they can definitely ask for a referral. They could also call into their primary care or send a secure message, kind of ask for a referral to get the process started for accessing care in that way. When we're looking at kind of residential care, that next step up, right? These are typically programs that they want to kind of see a veteran attempt to engage in outpatient care before trying, because it's a big commitment, it's a lot of things. So being able to kind of see like, is this the right level of care that they need? So a good kind of entry point to that is to kind of speak to a mental health provider about kind of residential options, as they can help kind of discuss different programs and what might be a good fit, and help kind of troubleshoot that whole process. Again, moving up to that third level of care, that's going to be our acute psychiatric care, that inpatient care, right? Again, typically these are going to be appropriate when we're at really acute symptoms and we're really concerned about the veteran's safety, being able to keep themselves safe. And so the ways to access this are going to be through the emergency department, the VA, or at a local emergency department, depending on where folks are located, calling 911 or calling the crisis line at 988. Okay, so moving on to some of the communication skills that we can use to kind of maximize effective communication with the people in our lives, and particularly with the folks in our lives that have got PTSD. So one of the things we want to be keeping in mind when we're thinking about communication skills is active listening skills. And so we're going to kind of talk through some of these pieces here that can kind of all be a part of active listening. So first of all, body language, right? So we want to make sure that we're facing the person, that we have kind of an open posture as opposed to kind of being closed off or turned away. We want to maintain eye contact with them when we're talking. Paraphrasing. So paraphrasing is when you're listening to someone, kind of asking yourself, what's the basic message or the feeling of the message? So, for example, if your loved one says something along the lines of, I don't feel like anyone cares about me, you can paraphrase and say something along the lines of, it sounds like you're feeling alone. Perception checking is another piece, and this is a way to make sure that you've received the intended message that the person in your life is trying to communicate. And so with a perception checking, this is going to usually include a description of the behavior, your interpretation, and then a request for clarification. So if we keep our example from before, when you said, I don't feel like anyone cares about me, I wasn't sure if you were feeling like we were not spending enough time together or if you had some care needs that we are not noticing. Can you help me understand? And this gives them then a chance to provide clarification, right? And reduce misunderstandings or miscommunications between the two of you. Summarizing. So this is pulling kind of it all together to get a sense of kind of the general theme of the conversation. And then you can verify and check with the person who's talking. When we're communicating, we want to be clear and concise when we're communicating with our loved one, because if we add on a bunch of words, if we add on like multiple sentences to our request, it can be easier for your loved one to become confused. If we think about some of those symptoms we talked about earlier, right? The difficulty with concentration or attention can also show up in conversations. So their attention span might be impacted by their PTSD symptoms. And so being able as much as possible to be clear and concise can help with that. And then reflective listening, right? So begin by rephrasing and or repeating what you think you heard, and then ask your loved one if you are correct, right? This can, again, help prevent the possibility of a misunderstanding. Another thing to keep in mind when we're talking about improving and utilizing effective communication is being honest, right? So addressing conflict with respect and honesty. Mixed messages can be really confusing, right? For both you and for the person in your life with PTSD. So you want to make sure your words are kind of consistent with your actions. As much as conflict is not something that folks always want to address, avoiding handling problems can definitely cause problems in the relationship, right? So we want to, as much as possible, not avoid it. And that being said, we want to make sure that we're prioritizing kind of being able to communicate. And if we're going to try to communicate, right, you have to learn to listen to what's being said. And this takes effort and attention. And so with that in mind, we want to try to make sure we're dedicating time for good communication. So not multitasking while we're trying to communicate something important, putting other tasks kind of on pause for a second, and choosing a place where you both feel comfortable. So you both going to fully dedicate your attention to this conversation. And then healthy conflict resolution, right? So when we think about maximizing this, obviously you and your loved one are humans and you're not always going to be in lockstep with each other. So there's going to be conflict at times. So how do we go about trying to resolve that in the best way possible? We want to be really mindful to not make blanket statements. So things like, you always do this to me, right? Words like always and never definitely close off the communication and will almost immediately put anyone, including your loved one, on the defensive in that moment, right? We want to own your feelings, right? Instead of blaming the other person. So be specific in this way, like I feel X when you do Y, right? Own how it's making you feel. This can help avoid or de-escalate potential conflict, right? So things like, instead of you always do this to me, right? When you and opposed to that, right? When you don't tell me that you're coming home for dinner, I don't know whether to wait for you or for I should go ahead and eat with the kids. And I'm confused by that and I find it frustrating. Being able to say that helps clear up, right, exactly what the question is. And no one likes to be told that they're wrong or that they've messed up. So we want to make sure that we're kind of being mindful of that when we're kind of pointing out a mistake and being generous with that, still pointing out the mistake, but being diplomatic in that conversation. And then lastly, making sure that we're kind of both parties are negotiating, right? So looking for what you and the other person want as a result of this conflict, right? What is the need or the concern that's being expressed by you and or your loved one? And then using that as far as like what the need or the concern is to try to find a middle ground or an alternative that might help you both kind of be able to move forward. So how do I encourage someone that I love to engage in care? This can definitely feel like a difficult conversation at times, right? People can have difficulty acknowledging or recognizing sometimes when they're struggling, and folks who care about them might struggle to figure out how to go about trying to express that concern. And similar to what we just talked about, right, when we talk about effective communication, avoiding the conversation, right, or avoiding talking about the trauma is kind of part of PTSD. We can make it harder to introduce that topic. And people rarely like having their mistakes or even their vulnerabilities pointed out to them, right? But that being said, right, we know that PTSD can contribute or exacerbate some of those interpersonal situations. At the same time, it doesn't remove the potential impact or the potential consequences of some of those interpersonal situations and those choices. So we want to make sure that we've set up a way to try to share those concerns with the loved one. And so things to consider are a number of these. The National Center for PTSD has some great helpful tips about how to go about having a conversation about care, right? So some things to consider are like expressing your support or your concern, right? Setting up a time to talk about those concerns so your loved one feels prepared. They don't feel kind of blindsided. Again, to kind of minimize that feeling, those feelings of maybe defensiveness or kind of being ambushed, even if that's not the intention. Bringing up your concerns and then maybe finding another time to talk about it instead of kind of feeling like you got to hammer everything out right in that one conversation. Keep in mind that you don't have to ask about what happened in order to support a veteran, in order to support your loved one. You can say, like, I'm sure there's some things that you have maybe some difficulty talking about. Would it maybe be helpful to talk to someone else at the VA or the vet center? Demanding that someone seeks help or using threatening language or ultimatums can definitely backfire. It can definitely make folks feel defensive. It can make folks maybe feel less likely to engage in care. So, like, being mindful of those things while also acknowledging that you can definitely, it's okay for you to let someone know that of how their behavior is affecting you. And talk about choices, right? You can definitely highlight that it's their call and their decision whether they go to see someone, but that if there's something you can do to help, for them to share that. All right, so some strategies to support your loved one who's dealing and working and coping with PTSD. As I mentioned earlier, right, social support is really significant, and it's one of the biggest predictors of resilience and one of the biggest predictors of success in treatment for PTSD. Also, showing care and support can be incredibly impactful for your loved one with PTSD. Even if it doesn't feel like you're doing much, so to speak, that care and that support is really good for them to know that it's there, as well as kind of knowing that it's something that they can always turn to. And then definitely supporting them while they engage in treatment can be helpful. So a lot of therapists will involve spouse or family member in treatment and can help facilitate a discussion about what the veteran's going to be working on in therapy, how their family member can support them in this work, and answer any questions that either of you have. So that can definitely be something that you can do. During times of struggle or kind of heightened emotions, some things that you can do in the moment would be grounding skills. So the idea with grounding skills is these are tools and skills that are designed to help bring that individual kind of back to the present moment instead of kind of being caught up in the past, like memories, or maybe worrying about the future in some sort of way, but to get them to kind of almost recalibrate to where they are right now and what's happening right now in this moment. So having them kind of focus on things around them rather than those internal experiences. So whether that's what can they hear in their environment, what can they smell, what can they touch. I've had folks use things like cold water or a cold drink or an ice pack. Kind of what can I feel, or what can they see. I've had folks kind of count fence posts and kind of or count light poles as they're kind of driving and being able to kind of focus on what's happening right now in my environment. And you can remind them that they're safe, that they're not in the environment when they experience their trauma. Again, the goal of that is to help them kind of recalibrate to where they are right now. Secondly, deep breathing. Deep breathing is a wonderful skill that you can use at any point in time, but it's really good in times of struggle as well. Because when you think about some of those symptoms that we talked about at the beginning, a lot of those are going to involve folks having a kind of heightened, right, physical response. So increased heart rate, increased breathing. Their body's going to be feeling tense, probably going to be feeling a bit warm. And so if we can do some deep breathing, right, pay attention to the breath, slow down that breathing, what that's going to do is also slow down heart rate. It's going to slow down that blood pressure. It's going to start to bring your body temperature down a bit, and all of those physical systems are going to start to calm down a bit. Therapy tools. If they're in therapy, encourage them to use the tools or the techniques that they're practicing in therapy. Just kind of when folks are in that heightened state, sometimes it's hard to think of the thing to do. So just being able to prompt, have a reminder could be really helpful. And then have a safety plan. If you kind of talk through with your loved one, okay, when this is happening, what do you want me to do? If I'm getting to this point, who do we need to call? Do we call your provider? Do we need to call the crisis line? Do we need to talk to another person? Like just having a plan in place can be really helpful for both you and your loved one to kind of know like, here's what we're going to do. If X, then we're going to do this. And both of you can kind of feel kind of on the same page about that. Some things that could be really helpful when a veteran is in treatment that you as loved one can really help with is reminding them to complete their practice for therapy. Definitely something that you want to make sure you've talked about with them, that it would be something that they would find helpful, as opposed to kind of, if they don't find it helpful, then we want to maybe not do that one. Definitely talk about it. And if they do find it helpful, it's a great thing that you can do. Getting involved in exposure practice. So for some therapies, some therapies involve kind of challenging oneself to do things that maybe they would typically avoid. And if they're doing a treatment like that, that can be really helpful for them to do those activities with their loved one. Being able and available, right, to talk about trauma experiences if or when that they are ready to talk about it, and if you feel able to hear those things. And celebrating successes. This one is really, I think, underrated. When folks are kind of going through treatment, it can be really easy for them to be maybe hard on themselves or not recognize the progress they're making, or when they've tackled something that was really difficult for them. So being able to celebrate that with them, cheering them on, and really highlighting that for them and can be really helpful because it's not always something that they're tracking or they're as aware of. Okay, so some additional resources that I definitely wanted to talk through and highlight for caregivers. The first one is going to be the National Center for PTSD website. This is a wonderful resource. It's got a bunch of information on PTSD, what does it look like, treatments for PTSD, how to access treatments, how to compare treatments, and then it's also got a bunch of information for families. So you can see that website on there. It's wonderful to use. Secondly, we've got the About Face website. So this website has got videos of veterans talking about their PTSD experiences as far as like their symptoms and how that's impacted the various areas of their life. It's also got veterans talking about different treatments. So folks who have done different types of treatment for PTSD and kind of videos of them talking about their experiences. It also has videos of providers talking about those treatments, as well as some family members kind of talking about the ways that they've been coping with this as well. So it's got some really great kind of first-person accounts of some of the things of experiences with PTSD, but also kind of what treatments can look like and what people can expect. And then third, I've got CRAFT PTSD. So this is Community Reinforcement and Family Training. This is a online course that is for family members of someone who's working to manage PTSD. It teaches family members how to, they can encourage their veteran to get treatment and support them during their care. It also offers tools for family members about improving their own quality of life. Talks through symptoms of PTSD and the impact PTSD can have on relationships. Gives folks a place to learn and practice some new skills to kind of help improve communication, to be more effective in that communication. And it also covers strategies that will help to make sure that you're taking care of yourself, whether or not your loved one seeks or is involved in PTSD services. A couple of resources I wanted to highlight that are within the Caregiver Support Program. The first one is going to be Reach VA. So the Reach VA is got one-on-one coaching that can help veterans caregivers practice stress and mood management techniques. It can help caregivers understand the your veteran's condition and can help with care planning. It also has got caregiver telephone support groups for caregivers that can help teach valuable skills to help problem solve and do stress management. And then secondly, I've got Annie PTSD. So Annie is a VA text messaging service that empowers veterans to take an active role in their care and promotes self-care for veterans and their caregivers. Annie for PTSD can help manage PTSD behaviors. So it can help teach skills and provide some motivational and educational messages to help with PTSD behaviors. You can kind of see some examples up there. For either of these resources, definitely talk with the caregiver support folks. They'll be able to help give you more information on those. And then I did want to cover a few VA apps. I think apps can be really good resources for folks simply because they're on your phone. And as long as you have your phone, you can access the app. So I've had folks use these across the number of different types of experiences, even when their phone is in airplane mode because they're flying somewhere and they need to be able to use something from the app, they can use it and just have it at their fingertips. So the first app that I want to walk through is the PTSD Coach app. So the first picture up here is going to be what it looks like when you have the home page, when you kind of open the app. And so you can kind of see the second screen is if you were to click on that Learn, and it gives you a number of different topics where you can kind of click on it and get some more information, questions folks might have about PTSD, and information that they can access when needed. And then the third screen up here is going to be if you were to click on that Manage Symptoms, right? You can kind of see it's got the little line under symptoms at the top. And so what this is that if folks are click on that and they're going, okay, I'm feeling kind of worried or anxious, well, then they can click on that, and what it'll do is it'll give them a coping skill to use. Sometimes when folks are feeling a particular type of symptom, it's hard to think in the moment of what skill should I use or what tool should I reach for. And so this will just give them one to do. And if they're like, oh, not that one, they can click next and do the next one that it tells them to do. And so they can use that in the moment as being able to something they can do real quick. So these, all four of these screenshots are if you were to kind of click on the tools. You can see there's a little underline under tools at the top. And this is essentially the library of tools that are in the PTSD Coach app. So they can scroll through these, use whichever ones they want to use at any point in time. You can kind of see it covers a number of different types of tools. There are some on there with breathing and grounding. So there's some ones that are right there in the app that they can access. The other thing that they can do is there's a little spot for favorites that they can kind of star the ones that are their defaults or the ones that they like the most, like kind of customize it for what works for them. And so that can be really helpful if they've got ones that are just like their go-tos, being able to put that in a way that's easy to access in the app. Second app I wanted to highlight is COVID Coach. So this app came out in 2020, hence the name COVID Coach, and it's getting revamped here really soon in the next few months to Coping Coach. And so The second screen here is going to be what you would see if you clicked on the Learn. So it's got, as you can kind of see, different topics that are a little bit different from the stuff that's in the PTSD coach, but still giving you information on those things. And it has a similar setup to if they hit manage stress, they get a similar thing. Are you feeling these types of things? Here's a coping skill that you can use. If you want to go to the library of it, you can hit tools and just scroll through all of the different ones that are available in the app. And then the same thing where they'll have a spot for favorites and they can kind of indicate which ones are the ones that they are most interested or the ones that they find most helpful so they can easily access that. All right, and then the last app that I wanted to highlight is the PTSD Family Coach. So the first screen on here is kind of the home page, right? Being able to kind of see what you're going to look at and what your options are within it. The second screen is what pops up when you first open the app and you first kind of download it. It'll give you a number of different possible things you might be interested in as a family member of someone who's coping with PTSD. And you can kind of select the top ones that you're most interested in, and then it will kind of customize and create you can see on this third screen, the suggested content. So that's going to include the things that you've indicated you're most interested in. Whereas then if you click on the all content, that second piece there, you'll get just kind of the library of all of the different things covering all of those topics that you can kind of see in that middle screen. And then the same sort of setup where there's a favorite spot where you, as the family member in your app here, you can kind of customize which are the things that like, oh, I need to have this easy to access. So I know I can come back to it easily if I've got questions or if I need a refresher on this or if I want to have a resource that I can have at my fingertips. So again, the idea with this app is this is for someone who is a family member of someone who is coping with PTSD. I've had a number of folks talk about how the veteran uses the PTSD coach app and their family member or their partner uses the family coach app and how they both use their apps. And they both find it helpful to have something that they kind of carry with them all the time because they always have their phones with them. And so that's a good option for folks to be able to utilize in the moment. All right.